Dear friends, I am Dr. Rajasekhar Mysore from Chirag Global Hospitals, BTM second stage, Bangalore. We also have a Chirag hospital for the past 30 years at JP Nagar second phase. I am a general surgeon and a colorectal surgeon, more into proctology for the past 3 decades. Now I am going to talk about a very important subject, which is where there is a lot of ignorance in people and negligence among the public. So July 28th is known as World Hepatitis Day. So let us see what is hepatitis. Hepas means it is liver. Itis means it is inflammation. Most of inflammations are caused by infections, but it can be caused by other causes also. Commonly, when you call hepatitis, it is usually caused by infections. So, uh, hepatitis is nothing but infection of the liver or inflammation of the liver. So when liver is affected, how do we know that somebody has got hepatitis? So it presents with the following symptoms. One is jaundice. That is the most prominent feature. Jaundice. Jaundice, how do you know a person has got jaundice? His eyes, which are that white colored eyeball will be there, white colored part will become yellowish, and even the what we call as conjunctiva. If you lift the uh, eyebrows and see inside, it will all be yellowish in tinge. So that is the main symptom of jaundice. Second is when they pass urine, urine will be dark colored, yellowish in color, orange. If it is too high, it will be orangish in color. So those are the main symptoms. Apart from that, when patient has got hepatitis, they have got fever, sometimes high fever, then body pains, chills, then tiredness, loss of appetite. They don't feel like eating. They have nausea. When they see food, they feel nauseating and they may vomit. So these are all the typical symptoms of viral hepatitis. Sometimes even bacteria, amoebiasis, all also can cause the hepatitis, symptoms of hepatitis. So in this viral hepatitis, there are 5 known varieties of viruses, A, B, C, D, E. So they are all different varieties of virus causing similar symptoms, but their route of infection are different, and then their severity and causing damage to the body as a whole are different. So commonest hepatitis what we find in our country is hepatitis A, which people say he had jaundice and recovered in 2 to 3 weeks with some homemade remedies or some juice of some leaves and all that, papaya leaves and all, it is known. So there it is, most of the times it is self-limiting disease. So it comes, it affects for a few weeks and gradually it goes off, completely it disappears. Very few patients only will have the a dangerous sort of damage to the liver, or it can persist for longer periods in very few patients. This hepatitis A is caused by contaminated food or water. So whenever you are taking food outside, especially during summer days, rainy season, then you be careful because the contamination is much more during those seasons. And eating food outside, you must be careful. Only eat cooked food, hot and cooked food because the virus gets damaged. And then you get safer food. Whereas fruit juices, cut fruits, pani puri, that sort of things which are handled by the people, the contamination, chances of contamination are very high. A person may be having jaundice and might have recovered from his symptoms, but still he will be passing virus in his stools, and that will get accumulated in his hands, fingers, especially under the nails. And when they're serving food, it gets contaminated. Or when they're preparing food, it can get contaminated. So that's how it spreads. So contaminated water and food we have to avoid hepatitis A. Then the other jaundice is common. Jaundice is hepatitis B. This is like a sister concern of hepatitis A. So this virus doesn't enter through the food or water. It cannot penetrate the gastrointestinal system to enter our body. But it spreads through blood, blood transfusions or through sexual transmission. These are the known, or through mother to baby, that sort of. So blood to blood, it spreads. So while taking blood transfusions, or if somebody is known hepatitis B, they should not give blood donations. They should not do. And then wherever you go, when you are a known case of hepatitis B, you have to tell the doctor for whatever reason you have go for a simple tooth issue, for any other issues. When you go to a doctor, you have to tell them that you are hepatitis B positive, because the doctors who are examining or who are handling with your blood, when they are collecting blood and all, they may get contaminated. So they may get the disease. So please, first you have to tell them that you are suffering from hepatitis B if you are a known case of hepatitis B. Then, apart from how it spreads, the other difference between A and B is, in hepatitis B, almost 50% body will clear that, and the rest of them can, even if they don't suffer from the disease, they may transmit disease to others through sexual transmission or blood transfusions. So they must be careful, and it should be known to their family members that they are hepatitis B. Second thing is, there is treatment for hepatitis B in the form of medicines. There are medications to suppress the virus, and they need not suffer from the disease, because almost 10% of the hepatitis B patients can develop major complications or long-term diseases.